Hey, Grandma. So you had some questions about cardiovascular disease and cholesterol. So I'm gonna talk about that. When you go to the doctor's offices, they usually test your blood for cholesterol, and they usually talk about HDL and LDL, and they usually break it up into those. But there's actually other types of cholesterol, or more specifically lipoproteins, which this cholesterol is a part of. Um, here's a here's a graph here where you can see you have your HDL, which they usually tell you it's the good type of cholesterol, and the LDL, which is low density lipoprotein. Then you have intermediate, and then very low density lipoprotein. But you also have chylomicrons, and they vary in size depending on what they're carrying. For example, chylomicrons have of a large amount of triglycerides. Here's another graph. If I can zoom in here. There we go. So you have triglycerides, which makes up mostly uh, the chylomicron. Of course, you have um, some cholesterol, which is there in yellow, and then some protein, which in this case for chylomicrons you have ApoB48 and ApoC1, C2, C3. ApoC2 is kind of important. We'll talk about that right now. Then in VLDL you have just almost as much triglycerides and a little bit more cholesterol and some protein as well. The LDL, which we would consider the bad cholesterol, it's bad because, well, there's a lot of cholesterol in it. Okay, you have some triglycerides and some proteins, almost equal amounts, but you have a lot of cholesterol. And then your HDL, you have, sorry, trying to get a good focus. You have a little bit of triglycerides and some more cholesterol, a little bit of cholesterol, but a lot more protein. Um, so, as you very well know, LDLs are uh, considered your bad protein. But I want to talk a little bit about the enzymes that interact with these lipoproteins. And I'll start off with chylomicrons. So chylomicrons are made in your intestine via the intestinal brush border cells. After you eat a fatty meal, uh, you know, you kind of digest it. Then the fat kind of forms these little spheres with the use of bile that kind of breaks up the fats. And so once these spheres or chylomicrons are formed, they pass through the intestinal cell wall and they enter the bloodstream. Once they're in the bloodstream, they interact actually with another lipoprotein, which you know is which we've talked about just recently is HDL, which has a protein. They kind of swap proteins, and this important protein that I mentioned earlier was ApoC2. ApoC2 is important because once in the bloodstream, the chylomicrons traveling now having ApoC2, um, and then these enzymes interact with this ApoC2, which is LPL or lipoprotein lipase, which is made by usually adipose tissue or fat cells. And once this LPL interacts with the chylomicron via the C2 protein, it then breaks it up into chylomicron remnants. These chylomicron remnants then travel through the endothelial cell wall into into the different layers of the vessel, and they kind of produce inflammation, and ultimately then they can also induce cell death or apoptosis. So what happens then is uh, this is how kind of cardiovascular disease occurs. You know, you have inflammation of the vessels. It reduces some of the, I guess you would say, the elasticity of the vessels because it's in the smooth muscle. This increases inflammation in the smooth muscle, and then cell death, which isn't really pretty, kind of turns it into atherosclerosis, which is hardening of your blood vessels. So that's one example of cardiovascular disease. Um, and this lipo protein, like I said, is made by lipase. Is made by adipose tissue. Um, this lipase also interacts with VLDLs, forming into IDL, and then from IDL, hepatic lipase, which is made in the liver, turns IDL into LDL, which then um, uh, kind of increases some cardiovascular disease risk. Um, so those are some of the two enzymes that I want to talk about, and the lipoproteins and how they interact. Some things to stay away from, which increase risk for cardiovascular disease, obesity, which also increases the lipoprotein lipase production. Also, eating high carbohydrate meals also increases lipoprotein lipase. Um, so there's some kind of the interaction there of why doctors recommend why you should lose weight, exercise, not eat so many carbs. So I'll talk to you soon. Hopefully that was informative for you, and we'll talk later. Bye.